Hi, Taylor and Chloe. I just want to start off by saying you guys did an incredible job with your presentation. It was clear, it was concise, it was easy to follow, and there was a lot of information in there, but it was condensed in a way that it made it easy to follow and understand and keep interested in as well. All the colors and the pictures, it was incredible. And I know when a lot of people think about adolescent risk taking behaviors, our mind immediately kind of goes to drugs and alcohol and like vandalism and things that can get them in trouble with the law. But the one that I pulled out of your presentation that really stuck out to me the most was something that not a lot of people think about, and it's sexual behaviors in adolescence. And it's something that is obviously very not talked about. In fifth grade, you get the video of this is how people develop, this is how girls develop, guys develop, things like that. The sex education that the public schools like to push on kids and pushing abstinence and things, but it's not realistic to think everybody is going to remain abstinent. It's even without religious beliefs or anything, a lot of people do need that education in preventing unwanted pregnancies and sexually transmitted infections. And moving past the idea of sexual assault, because that's a whole other bear that would need to be addressed. Wanting, I'm specifically talking about sexual interactions that are wanted from both partners. Working in the OB office, we have patients as young as 11 coming into us with sexually transmitted infections, and it's hard to then sit there and understand and hear this and see the results and not, and I don't want to say judgment, like I'm not a bad person, but it's like that initial reaction is, why is an 11-year-old having sex? And it's things that we need to think about. We need to think, why are they? What do they know about the sexual interactions that they're having? How can we keep them protected? I know the youngest I've seen in my office in the last 2 years, I think I've been there, was 13. And it's crazy to think because a lot of people don't start menstruating until 13, 14 years old. Average age is like 12. So I know on the topic of sexually transmitted infections, ACOG, the American Gynecological Association, what the OBGYNs follow, and the CDC both recommend gonorrhea and chlamydia testing at every annual exam for every person under the age of 25. Well, up to 25. And then after 25, it's just up to the patient's discretion. And of course, that these younger patients can turn it down, but it is highly, highly recommended. And we always brace the conversation of bringing up sexual interactions with these, especially really young patients, is explaining why I'm asking you these questions, why these questions need to be asked, and what is going to come of this conversation and what we can do to help you in the future. And it's always needing to approach it with sensitivity and not a judgmental manner. Like I was saying, you can't be like, why are you 11 years old and having sex? It's, do you know safe sex practices? Do you feel safe in your relationship? Does anyone force you to do anything like that?